We all took tours, right?
Yeah.
Some sort of tour of the ship.
Yeah, we
You
did.
know, as we are on the bow of the ship and we're looking out that way, and as our tour guide had explained it, the ship is actually looking over the Arizona Memorial, kind of standing guard.
Right.
Yeah, I
And
like that.
The memorial. I mean, this is such a, within close proximity, so many different things to see. You talk about the memorial, the ship itself, the Bofin, the Pacific Aviation Museum. By the way, we'll be talking to people from the museum over at the Pacific Aviation Museum about what they've been going through. I mean, they're growing so fast, not only with their popularity, but the exhibits are amazing. They're adding almost every day.
And I think as you walk up to the battleship Missouri, the size and scope of it is really what struck me, especially the gun turrets that are behind us. And what I learned just recently is that the shells that they used during World War II, one shell would weigh as much as a Volkswagen.
Right. Yeah, about 2,700 pounds.
Can you believe
16 inches in diameter.
Well, the thing is, the gun would fire it, and it could go 23 miles in less than a minute.
Yeah.
If you can imagine that weight being transported that far
And they
that
said
quickly.
It would hit with accuracy,
yeah.
too.
Oh, yeah. Pinpoint accuracy.
And for the next few seconds, the boat would be moving in the opposite direction. We're not just talking about Veterans Day and about the ship, but also about veterans issues. And of course, the big issue this year has been health care for veterans. Senator Bernie Sanders of Vermont saying we don't deserve to send people to war if we're not going to take care of the wounded afterwards. And so there's been a big focus on that. And we thought it would be appropriate to speak to the leading VA official for this region and find out what kind of progress has been made on that front lately. We're up on the hill where Tripler is, and also the VA Medical Center. And Wayne Pfeffer is the head of the VA for Hawaii and the Pacific region, and has been for about a year. In May, addressing the issue of long wait times, you described what things were like then, and you set yourself kind of a goal. First of all, what were things like in the spring?
Well, when I first came last October, we had about 145 days waiting for a new patient to have an appointment, and about 1,900 patients on our waiting list waiting to be scheduled. Now I'm proud to say that we have no waiting list. The only people on the list are people in American Samoa that we're trying to work on their optometry needs. There's a shortage of optometrists on the island, but for the rest of our veterans, there is no wait. And the average days have gone from 145 to 35. And my goal set for the fall was 30, so we're just about there, and I'm anticipating very shortly we should hit the 30-day.
What kind of changes did you and your people working with you on this have to undertake to make this progress?
It was a tremendous collaborative effort and very dedicated staff. We increased the number of appointment slots per provider. We opened up evening and weekend clinics, and we began to hire additional clinical staff and developed a plan over time to bring it down to where we are now.
A lot of people thought initially, or perhaps wanted to believe, that this was about people, that if a couple of really evil people were pushed out, everything would be fine. But bureaucracy being what it is, I always assumed that there was, in large measure, a systemic issue you had to address.
Yeah, I think the big issue here is supply outpaced demand. Demand outpaced supply. We have about a 5% growth rate in Hawaii for new veterans coming into the system, and the staffing and the space didn't quite keep up with that. And space has been a major challenge. And I'm pleased to report also that through the new Affordable Care Act, we were approved for a new clinic in Leeward. It's the Aloha Project, which will pretty well double our ambulatory care space. We're also looking to expand on the various islands. So we're gearing up the space to be able to house the clinicians, and then we're hiring the clinicians. So it's all coming together as a really good plan.
And actually, this is happening fairly fast. You haven't quite met that 3-month goal you had set yourself, but you came close. And that's a short time frame for moving such a large organization.
Yeah, we're lucky that everything came into line as we envisioned it. The staff were very willing to go with the change, to work extra hours, and it was a really team effort that came through for us.
And that last part's especially good news, and today of all days. When we talk next to Wayne, we're going to go into how many people are involved in this effort and how many patients are actually being dealt with.